So if I'm working on my own means to manage anxiety, for example, with maybe it's a client meeting, it's something new I'm learning, I'm going through that process and I'm understanding what that's really like to put coping skills into place and to overcome them. You can also recognize that in others. So I'm not saying leaders are going to be therapists, absolutely not. But as a leader, helping people and say, I've noticed this. Have you ever considered some of the resources we have at our organization for how you overcome managing stress or anxiety? So it's a mean to help coach people to get them where they need to be.
Hello, and welcome to the Mental Health Advantage podcast, where we talk with leaders in HR and mental health to uncover strategies that improve workplace well-being. Today, I am honored to be joined by Elisha Engelen, Aon's human capital leader with a background in both clinical mental health and corporate well-being. Elisha has been on the forefront of designing programs that support employees, reduce stigma, and drive proactive mental health strategies across industries. Elisha, how are you?
I'm great. How are you doing today?
Great. It's really good to see you.
Thanks, you
So
too.
first, you just stepped into a new role. Why don't you tell us a little bit about that?
Yeah, so I really appreciate the introduction. It's somewhat humbling when you think about the things that you've been able to do in your career in partnership with others. So, licensed marriage and family therapist by background and training, and that systemic training that I've had, I wanted to take it to a new level and do something more with it. And so in my current role at Aon as a human capital client leader, is what I get to do is I get to partner with our current client teams or maybe future client teams that we'll do more work for and think about the sphere in which they're looking at their total population health. And that includes, how is the health of people? How is the wealth, meaning like financially, how are people doing? How is companies investing in their people? What does that have an impact on their health, for example? And then think about talent, right? So how do we attract, retain the best talent? And then again, looking at how do we compensate them and how do we bring a total reward strategy? So that health, wealth, and talent, if you think about it, systemically, it really falls into line with my mental health background. And I'm excited for the new venture.
I love that. And before we go into your background, what do you like most about this new role that you're in, and what's the most challenging?
Ah, what I love the most about is I'm learning a lot and I'm learning about everything Aon's capable of doing. And then I'm also getting to dive into just industry differently. I've been historically more nationally focused, and now I get to focus on Minnesota and Iowa. Now, don't get me wrong, I'll still get to dabble outside of that, but like getting really deep into the roots of Minnesota and the organizations here, I think is really unique and different from what I've done historically. I think the challenging piece is like understanding like you can learn so much and you're going to embrace pieces at a time and being patient with myself as I'm bringing that all together. And I will say my colleagues have been phenomenal. And so that journey is up and going, and it's a day-to-day growing opportunity.
I love that. Well, congrats again. I know you're going to have
Thanks.
a big, big impact. Let's go back. So you have a really rich career. How did you first get started in this space?
So interesting fact, I don't think you and I ever talked about is I wanted to be a pediatric dentist when I went to
Okay.
college. That did not pan out. I took a general course in psychology at the University of Wisconsin Eau Claire, fell in love with this dynamic of behavior, the science of behavior, people's family of origin, all that good stuff, and got a degree in psychology and then pursued higher education, became a therapist. Started boots on the ground, community based mental health, started to do outpatient, had a career before I came to Aon at Cigna as well, and enjoyed that journey of helping clients meet their needs, whether it was in the autism and the eating disorder program I was leading, or even as I've done some stints with inside of that organization, helping our employees with their learning and development. And then I reached a point where I'm like, I want to do something more. And that's where I joined Aon. Colleague of mine said, I think you're curious, you're interested in growing. I think you'd love consulting. And so when I came to Aon 3.5 years ago, it's just been a great opportunity to expand what I know in different ways and bringing value to employers and their employees.
Fantastic. Well, a lot of people are benefiting from the fact that this is the path that you've chosen. So in the book, in my book that just came out, The Mental Health Advantage, you and I talked about leadership, and you said employees look to leaders for guidance, and when leaders prioritize their own mental health, it sets the tone for the entire company. Can you talk about why that's important, and then to piggyback on that, how HR leaders and other executives can prioritize their own mental health to support themselves and therefore employees?
Absolutely. Being a people leader, I've always seen it as a privilege and an honor. It's like that extra layer of what you do day in and day out. And there's certain roles in organizations where people leading is what you do, and there's other roles where people leading is in addition to what you do. And as you lead people, you have to role model. You have to be able to show them, how do you navigate, how are you resilient. If you're in a meeting and you make an error, how do you not let that stress bubble up to the point where then you have some behaviors that come out that aren't so great. I had someone once say to me, you see someone's true self in type of crisis or need. And so I think as a leader, managing your own mental health, your emotional well-being is key, because all the people you need to have a role model to show them how that's done, both the good and the bad days, and how do you manage that. And then also, when you're leading people, it's like I said, it's a privilege. And so helping them navigate. So if I'm working on my own means to manage anxiety, for example, with maybe it's a client meeting, it's something new I'm learning, I'm going through that process and I'm understanding what that's really like to put coping skills into place and to overcome them. You can also recognize that in others. So I'm not saying leaders are going to be therapists, absolutely not. But as a leader, helping people and say, I've noticed this. Have you ever considered some of the resources we have at our organization for how you overcome managing stress or anxiety? So it's a mean to help coach people to get them where they need to be within the resources an organization has. And then as a leader, people will follow your behavior. And so if I'm doing well, others will hopefully do well, or I can help maximize that. And then you asked a question about you asked a second part to that. Can you repeat that part that you asked?
Yeah, you touched on it a little bit, but the second part was how
Okay.
can leaders and executives prioritize their own mental health? So anything that either you've seen or you personally do to support your own well being.
Yeah. So what I learned earlier in my career as a therapist is that I can't suggest things for people if A, I haven't tried it myself to some degree, right? Or I don't know that. So for me, what I do is I love to run. If I didn't live in Minnesota, I'd be running year round. I have been doing a little winter running this year, but otherwise I'm on the Peloton. But I set a goal for myself with I love 10-mile races and I love half marathons. If I have those on my calendar, I have enough pride and ego that I want to do well and feel well. And so that's a goal that I'm using. And then I talk about it, right? And I talk about it because maybe I got to leave at 4:30 someday from work. So I have a boundary and I'm sharing that with people. But it also keeps me moving forward in the right direction. And I think the other thing too is when we get challenged, and there are things that we can't solve, we need to get to the cause of that. And part of that is just like mental emotional well-being just bubbles up through that. And if you're able to bring that to the forefront and ask for help with it, it just makes you so much stronger and you feel better coming to work and at the end of the week.
Yeah, I think that's right. I mean, for me personally, sleep is the thing that if I'm not getting a good night's sleep or I'm only sleeping a handful of hours for consecutive nights, I know that I can't show up in the way that I need to for my team, for my wife, for my son, and I don't make good decisions. I'm more, testy and snappy, and so for me, that's like a foundational piece. And then layering on top of that, eating well, or exercising, or meditating, or ideally all four of those. It is very essential. The other thing I'll say is for me personally, my work life, I don't really love the idea of work life balance per se, because then it feels like something's out of whack. But the idea of work life harmony or work life integration, for me, I work a lot. I enjoy work. That's just one of those things. And so I need to make sure that I'm communicating as a leader to my team that what I do is not necessarily the expectation. Because if that goes unspoken, then it's, oh, well, if Steven's working late, Steven's working on the weekends as CEO, therefore he's expecting the same from me. And so being clear to communicate that consistently of this is just what I do, this is not what's expected, makes a difference, I think, for the team. All right.
100%. That role modeling is huge. Yeah.
Yeah. So let's talk about mental health in the corporate setting. It's obviously evolved quite a lot over the last few years, the pandemic being one particular time. But I'm curious if you can share your perspective, what you've seen pre-pandemic, throughout the pandemic, and now.
Yeah. So pre-pandemic, I think people were aware of mental health, but I think they saw it more in a diagnostic, meaning so and so has died by suicide, or that person's really depressed, and more of this like very much a diagnosis can a link to something, and I'm talking about layperson assessment of life, and more of a like an illness focus, which we still need going forward. So hear me right, but more of a limitation. During the pandemic, people were put in a position where all of a sudden their community was taken away. Maybe their coping resources were taken away. I'm in an office today. I always come into the office unless I'm traveling or with clients. That is my need. So during the pandemic, I didn't love that. And then people were in these bubbles and they were reaching out to others for community. And I think they started to have these conversations. I do think, like I just mentioned, working at home wasn't awesome for me. Some people really had serious mental health that bubbled up for them, or substance use. We had different lives. We weren't traveling as much. We were at home more. People were finding entertainment in different ways. And sometimes that was through substances. And so there's this evolution, and things were either bubbling up or things were coming to light. Not to mention people teaching and parenting and all these other hats that they were wearing that just became unsustainable. So mental health was going to be impacted, whether someone that tends to have that more genetic disposition or has experienced things in your life that leads to that, or things come with either seasons or experiences, in which a lot of people had. After the fact of COVID, which I would say after the main piece of our isolation and people being sick and being scared, people are now looking at what's important to them. And so, where someone would have maybe tolerated a lower level depression, and this is just who I am, and this is what it is, and it's never going to get any better, and I don't have anyone to talk to, I wouldn't talk to anybody, that shifted now, where I think people are thinking more preventatively about mental health, which is awesome. So it's not that illness focus that I saw more before the pandemic happened. And it's also about people having a conversation about what's difficult, what's a challenge, and then getting help for that. And then even when it comes to treatment, I think people are sharing their treatment journeys and experiences to help others with theirs, which is that's new for what I've been experiencing, both my social circle and then just the leaders I'm working with, shedding light on how this needs to be a better journey for people and how can we do that.
Well, I love hearing that you're seeing the preventive part coming out more, because as somebody that, a decade ago started a proactive mental health company, it's nice to see that that's, percolating and coming to fruition. And yes, it's true what you said, right? Like the stigma is being reduced. People are talking about things more openly. And I think that that's obviously going to be a net good for kind of companies and society more broadly. Let's talk about I don't know if I'd call it the flip side of it, but many companies, all companies, most companies offer mental health benefits, whether that's through an EAP or their health plan, but engagement remains low. What do you think are the biggest barriers to adoption when it comes to these types of benefits and services?
Yeah. I think when we talk about stigma of mental health, I think the stigma around employee assistance programs leads people to think it's more of a disciplinary direction for some. I have also will give the example of I've helped people in my personal life navigate to their EAP. And the minute it says contact human resources for information, they're like, what? Like, that's not what I'm looking to do here, Elisha. This isn't what I want. The other thing, too, I think where EAPs haven't gotten the boost they needed is when they're a checkbox and not, to your point, around prevention, around helping people with that solution focused therapy that they need as well. And, the other thing I've learned through this business is that not everyone has an EAP. And so there's that piece too that isn't there. So I think when I think about what hasn't worked, I think it's some of the things I've talked about. But I want to make sure I answered your full question. So please elaborate from where I went to make sure I captured that.
No, you touched on it. I mean, look,
Okay.
engagement is low for a bunch of reasons. One is what you said, right? Like, well, you didn't name it this, but I'll name it this. Like, there
Yeah.
can be a lack of trust between employees and employers, and if they see they have to go through HR, or even if they don't see that, is Big Brother watching? Are people going to know that I'm speaking about my boss or my husband or my wife or whatever issue I have, right? So there's that element of trust. I think there's also a lack of awareness. Um, Studies have shown that with traditional EAPs, less than 20% of employees are aware of it. So, I mean, if you think about that, like it's not surprising that 2% of people use it if most people are not even aware that it exists. And to your point, they've been historically set up as a reactive tool. Somebody shows up to work intoxicated, there's some type of abuse. Oh, we'll call in the EAP versus, to your point, we're being proactive, we're being preventive. And so when it comes to engagement, thoughts on how HR teams can overcome that, thoughts on ways that HR teams can drive higher engagement with their mental health benefits.
So I'll give a couple examples, and some of them are things that I've experienced. So I've had scenarios where I've been leading people that have had a situation in life where I've said to them, have you called our employee assistance program? Have you engaged with you and maybe your spouse to help navigate that? And that happened in a scenario that then this person went about and told their story. And they told it at an organizational level, and they connected that back to the help that EAP was part of that journey in partnership with their leader. And so people started to see the narrative differently. So that's one thing. The other thing is, I think when we're having campaigns, whether it's May's Mental Health Awareness Month in the US or it's a Global Awareness Month in October, actually bringing in people from the EAP to do trainings or have conversations or directing people. Again, the storytelling and the experiential piece of it brings it to a whole new light for individuals. The third thing is, and I've talked about this, like I've called the manager line for our EAP to get consult, and I'm a therapist, but I joke with people, and I can't do my own therapy, right? So I have even used that. So I think it's storytelling. I think it's about doing a campaign or talking about it and bringing it to life, and then keep talking about it, and then shining a light on leaders who do a good job or employees that put themselves out there as role models. Those are a couple things that come to light.
Yeah, for sure. I agree 100% with all those. I think a lot about how do we make it personal for people? So it's not, hey, here's this corporate benefit that's offered to you. Okay. Versus, hey, you're a new mom. We have something for you. Hey, you have questions about finance or about elder care or about family planning. We're here to support you. Hey, you're a brand new employee. We have a whole bunch of stuff to assist you in that transition, right? So making it much more personal and then getting creative. So
Yeah.
not simply, oh, we did a lunch and learn, check. Oh, we put up posters, check. Like those things are important, don't get me wrong. There is no silver bullet. It's not if we send this one email or we put up this one poster, but it's how do we get creative and capture people's imagination? Because we all know we're all so inundated with stuff all the time, right? It's like I'm in
Yes.
New York, as you walk into Times Square, you don't see any of the advertisements because it's just your body, your mind just shuts it down. It's just too much stuff. And people are the same when it comes to their corporate benefits. They don't pay attention. But if you just gently keep nudging them, keep showing it in different ways, then when they need it, they'll say, oh, yeah, I have that available to me. So I think that consistency of messages is important. All right,
Exactly.
let's talk about beyond simply the benefits. So, how can organizations take a more systemic approach to mental health, policies, training, things like that?
Yeah. So I think one systemic thing that I've seen work well is where the ecosystem that an employer is bringing forth, connecting the dots and asking their vendor partners to connect the dots with them. So let's say you have someone call in and they're struggling with back pain. How is that maybe a connection with mental health? Or how has maybe that disability claim then turned into financial hardship? So to your point and what you're alluding to is how do we help people from a work life standpoint? So I think that's one thing to think about. I think the other piece with the systemic part is getting to the root cause of things. So if we see an increase in people maybe utilizing a financial benefit. Like there's certain organizations that within their EAP, they'll offer like rent assistance. Why is that? Do we have a social determinants of health consideration within our population? Can people not get to healthy food? Can people not get to affordable housing? How are we thinking about the spaces people live in outside of our working walls, which is interesting, right? Not everyone works in an office. So when I say working walls, like our company walls, and so that they might be working in their house, but that's within their walls. So I think it's around connecting your ecosystem. So if someone's seeking something out, how are you helping them see the full sphere of where things might be mentally health related as they are physically health related? The other piece I said around social determinants of health, as organizations get to the root of why you're seeing trends versus accepting something for what it is. How do you help people in a larger way? And then the other thing I would say systemically too is, how do we create community? I think there's this question now, since the pandemic, it's definitely opened up the doors for more virtual working, different ways of working, which is great. But how do we create community and integrating these pieces of well-being and health into the day for people? So we reduce some loneliness because we know that's still epidemic, and then also help people from a well-being perspective, and that's that preventive piece. Like you're here to do a role and and do a job, but like how do we also take care of each other at that time to get you there?
Yeah, I think you've I'm sure heard the stat from the U.S. Surgeon General on the loneliness epidemic, how it's the
Mhm.
equivalent of smoking 10 packs of cigarettes a week
Wow.
or something like that. And it's true, right? We're social creatures. We evolved to be in community with each other, and now we live these isolated lives, especially working remotely. And so having that connection to one another is really important. I think one thing that we talk about at Journey, and it's been kind of something I've been working on a lot this year, is how do we empower people to do the best work they've ever done? And there's a lot of elements to that, right? And one important part is, how do you have a culture that really supports that? And what I find is oftentimes, so putting Journey aside for a second, but oftentimes people will think, what's the thing that I can add? How do I add this thing, whether that's a benefit or this or that? And when I'm thinking about Journey and I'm thinking about how do we create that environment, part of it's also, what do we not do? Let's make sure that we're not putting two people's jobs on one person. Let's make sure we're not constantly having unrealistic priorities and deadlines. Like, look, we support many of the biggest companies in the world. Sometimes they come to us and say, hey, we need this tomorrow, or we need it. Okay, that's going to happen occasionally, but we have to be set up so that that's not the consistent, that's not the norm. And so I think when it comes to supporting people's mental health, it's not so much let's just continue to add more and more programs, but also let's look at what that experience is like and make sure that we're set up at a foundational level to support that kind of work.
Absolutely. I think what you're getting towards is like workforce design and efficiencies and effectiveness. And so I recently talked little bit in an article I put on LinkedIn around burnout versus bore out, and this difference between people being to the max and working hours and having that be something that is unsustainable from a burnout perspective versus just maybe not being challenged or inspired in their role. But to your point around like what is an organization doing culturally, like how do we give feedback? How do we recognize people? How do we make sure we are hiring the right people? And stay interviews too. I love a good stay interview if it's done in a psychologically safe space where people can say what they love, what they dread, and what skills aren't you using. I got an opportunity to meet with someone just the other day, and we talked about like a stretch assignment. And what's a stretch assignment, right? Like a stretch assignment is being able to do something outside of your current role that inspires you. It creates maybe career progression, things such as that nature. Like to your point, like how do our people tick? And then how do we help them have the best structure in which to operate, whether that's tools or resources or the way in which we're asking people to do things. And you're right. If we have to call on someone and say, hey, I know it's Friday at 4, but I need this, they're going to do that because time after time, you've helped them manage their balance. And it's really a way to give back to each other that's different. So
Yeah, I love the concept of stretch assignments. What other goodies or little nuggets do you have for us in terms of things that you've either seen at a client, or things you've tried yourself, or seen within Aon, in terms of helping people to feel supported and be empowered to do their best work?
I think part of it is about being a psychologically safe leader from a standpoint of let's create a framework where we can give each other feedback. And so what I've found in my time, whether it's in my previous role or in this role, is role modeling that idea of feedback. So I want your feedback, and I need to give you feedback, and then what are we going to do about it? And I think it's about if someone gives me feedback about maybe something I've said or something they need differently, like then helping progress that forward and not have that be feel like it's a retaliation type of situation. So feedback is so key, and that psychological safety component of that. I think the other thing is, you know, letting people know you're human as a leader. I'm going to have good days, I'm going to have bad days. Sometimes I've said to people, I'm really sorry, I feel frazzled right now, so I might not be 100% there. So they know it's not personal, because sometimes we look to our leader to create a mood. And if you're not in a great place, just call it. That's my style. That's not everybody's style, because I think sometimes that hits our ego a little bit. The other thing I would say too is it's about coming back around to people and sharing what you're thinking about. And so if I've had an interaction or a meeting that went well or didn't, like how do you come back to that? Me and a colleague led discussion yesterday internally, and I said at the end of the discussion, as we were instant messaging before getting together today, I said, I want feedback on how that went. So I'm also prepping people for what I need and then asking for that in return. But honestly, Stephen, I think part of it is having a dialogue and making sure it's a dialogue and not a lecture or a monologue, and all becoming better because of it. It makes it more enjoyable, and you meet friends at work. That's a good thing too.
Sure, for sure. And going to the point about putting your hand up and saying I'm frazzled and doing it proactively. I'm sure you could speak to this better than I can, but people will often fill in the blanks and interpret stories or create stories when something's off, and especially in positions of power. But I mean, for me, it
Mhm.
happens with my wife. If something's off, I immediately think, is it me? What did I do? And then you start going, in your mind, oh, is it that thing? Did I not do this? Did I do this other thing? Should I not have said that? It happens with children, right? And it also happens in the workplace, right? Somebody shows up to a meeting and their boss is pissed off, and the boss isn't putting their hand up and saying, hey, this has nothing to do with you. I just got some bad news about, this health thing or this thing, or I had a bad client
Mhm.
call. And then that person goes and it's on them. And, so I think putting your hand up and saying, hey, I'm coming in this place mentally or emotionally, number one, really helps that person in that communication, builds trust. It also models it and says, hey, this is an environment where we can say that, where we don't have to say, oh, how are you? I'm good. How are you? I'm good. When in fact, it's the complete opposite.
100%. And I just want to add something to that if I could.
Please.
So when I did couples counseling as a marriage therapist, so people married, not married, didn't matter. One of the things I talked about was, Mad Libs as a kid, you'd fill it out, you put in a noun and adjective. That, to your point around people create a narrative, like it's almost like you're filling in a Mad Libs, where if we're not having a conversation about where we're at, like it becomes a Mad Lib story, which sometimes is funny and sometimes is not funny. And so to your point around the workplace, like we need to have those fill in the blanks be things that are true and not assumptions. So
I think that's exactly right. All right. As we start to come to a close, two questions for you. Upcoming trends that you see shaping the future of workplace mental health.
a couple of things. Financial well-being has come up a lot, and I think our state in the US, I will say, with the cost of living and the lives people live and social media's influences on people's spending, I think it's a big one for employers to watch. And what I'm seeing through studies is that employees are wanting their employers to give them information on that. And I've seen it time and time again, whether it's in therapy or in employee settings. Like when people's finances aren't in order, it creates an impact on their mental health. And so that's something they can get coaching through work life. So I think financial well being is a big one. I also think people's concerns about AI. And I think AI has great places for us to take advantage of. And yes, there are some roles that will be enhanced. There's some that maybe will be replaced. but there's a means in which we can work within that to become better. So whether it's about data generation and helping us steer to better levels of care quicker, through assessments that have guided over time, whether it's about, searching for something and you're guided to that through generative AI, whether it's about tools that we leverage in the workplace to be more efficient. Like, I think there's a benefit to that, but there's a lot of scary unknowns. And so I read a recent article that talked about like lean in and help figure out like what it can do to be helpful. And then organizations are going to be embracing it. It's just a matter of how and being part of like the mix of it. And it can be fun and interesting. And then I think just the third thing is that, people want to work in organizations where they bring value. And so making sure that we are working with individuals to feel like they belong, I think is huge. And that's through, good mentoring, one-on-one, and then resources. And part of the resources that are also trending high is people want mental health resources. So I'll end it on that note to say, for those that aren't offering EAPs, or for those that aren't thinking about that ecosystem where people enter to get mental health, or making sure there's no wrong door, like how do you do that and how do you help people?
I think that's a great place to end. Your insights obviously reinforce that leadership's commitment to embedding mental health into the workplace culture is important. It starts with them. It's not simply based on just benefits. It's how do we create this culture and this environment, these systemic changes. And thank you for sharing your insights. Thanks for doing what you do on a daily basis. I know you're super passionate about it, and that ripple effect that HR leaders can make, and managers in general and leaders can make in the organization is pretty huge. So I appreciate you sharing your thoughts on this today.
You're welcome. Thanks for having me. It was fun, and got me thinking about some things I want to do.
Well, enjoy your lunch, enjoy your next run, and if you enjoyed this podcast, please subscribe, rate, review. I'm Stephen, and this has been the Mental Health Advantage podcast. Have a beautiful day.